Hello, my name is Dr. Dewan S.Raja. Today I will discuss about multiple choice questions on diabetic complications. A 55-year-old woman with a history of type 2 diabetes mellitus presents to the clinic complaining of worsening vision. On ophthalmoscopic examination, you note retinal hemorrhages and microaneurysms. What is the most likely complication contributing to her visual symptoms? These are the choices: A. Diabetic ketoacidosis, B. Peripheral neuropathy, C. Diabetic retinopathy, D. Diabetic nephropathy, E. Peripheral vascular disease. What is the correct answer? Most likely complication contributing to her visual symptom is diabetic retinopathy. C is the answer. Diabetic retinopathy. Question number 2. A 62-year-old man with a long-standing history of type 2 diabetes mellitus presents to the emergency department with acute chest pain radiating to his left arm. His ECG reveals ST segment elevation and cardiac enzymes are elevated. What is the most likely diagnosis? These are the choices: A. Diabetic nephropathy, B. Diabetic cardiomyopathy, C. Diabetic neuropathy, D. Diabetic ketoacidosis, E. Acute myocardial infarction. So what is the most likely diagnosis? ST segment elevation, cardiac enzymes are elevated, pain radiating to the left arm, chest pain, and long-standing history of type 2 diabetes mellitus. What is the most likely diagnosis? Answer is E. Acute myocardial infarction. Acute myocardial infarction. Question number 3. A 50-year-old woman is found to have elevated triglyceride, low HDL, high density lipoprotein, cholesterol, and central obesity. Laboratory testing reveals fasting blood glucose of 189 mg per 100 ml and an hemoglobin A1C of 7.5. She mentions a family history of diabetes and heart disease. Which of the following condition has she developed? A. Polycystic ovarian syndrome, B. Type 2 diabetes mellitus, C. Hypertension, D. Osteoporosis, E. Type 1 diabetes mellitus. Okay. So, from these choices, the best choice should be type 2 diabetes mellitus. B is the answer. Type 2 diabetes mellitus. This is the answer. Type 2 diabetes mellitus. Question number 4. A 60-year-old woman with long-standing type 2 diabetes and obesity complains of persistent joint pain and stiffness, particularly in her hands. Examination reveals swelling and tenderness in multiple joints, dry eye, and mouth. What is the most likely comorbid condition associated with her symptom? A. Osteoarthritis, B. Gout, C. Fibromyalgia, D. Rheumatoid arthritis, E. Lyme disease. So, what is the most likely comorbid condition along with type 2 diabetes and obesity? Answer should be D, that is the rheumatoid arthritis. Rheumatoid arthritis. Joint pain, persistent stiffness, particularly in her hands. So most likely the diagnosis is rheumatoid arthritis. Question number 5. A 58-year-old woman with type 2 diabetes is prescribed metformin as part of her treatment plan. She has a history of chronic kidney disease, CKD. What is the most appropriate action regarding metformin in this patient? A. Discontinue metformin due to CKD, chronic kidney disease. Increase the metformin dose. Switch to a sulfonylurea. D. Continue metformin at the current dose. E. Decrease the dose of metformin. Okay. Most appropriate action regarding metformin in this patient is A. Discontinuation of metformin due to CKD. So, this is the A is the answer. Discontinuation of metformin due to CKD. That's all about the multiple choice questions on diabetic complication today. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.